Oklahoma ranks 35th in the nation for the number of child abuse and neglect cases. Statistical data is important to show us where our weaknesses are, but it doesn't tell us why. World-leading child welfare experts from Israel and the United States came together this week in Tulsa to try to find out why children are being abused and to discuss solutions to the problem.
1/3 of all children abused or neglected in the United States are harmed during their first week of life. 78% of children killed were younger than 4 years of age. At a conference in Tulsa, child abuse and neglect experts from around the world discussed ways to prevent the problem.
This is really the advancing of child abuse and child maltreatment as a science. Before, it has always been an intervention and a service that has been delivered by welfare agencies, by pediatricians.
Researchers and doctors shared their ideas at the University of Oklahoma Schusterman Learning Center in Tulsa. Dr. Jerry Clancy is the president of ou-tulsa.
Probably the biggest thing I've learned is that the science is moving toward prevention of child abuse, which when I went through medical school was unheard of.
The collection of data is an important part of the science, but interpreting it correctly is the key.
Neglect hasn't gone down at all, which I'm not surprised about because the poverty rate has fluctuated. It has actually gone up in the last couple of years. And the homicide rate of children, although physical abuse has gone down, homicide stayed the same, which means we haven't figured out how to prevent homicides.
Professor Richard Gellis is the Dean of the School of Social Work at the University of Pennsylvania and an internationally known expert on family violence. He says many child welfare workers across the nation are not making children their priority.
A lot of child protective caseworkers see the parents as their client and see their obligation as to heal the parents so the children can be returned, and that turns out to have fairly significant dire consequences. Of the homicides that take place nationally, half of those children are already known to child protective service systems.
Gellis says child welfare agencies in 26 states, including Oklahoma, are operating under court orders after being sued by legal groups like New York-based Children's Rights. Gellis says while the lawsuits have gotten the state's attention, they haven't accomplished much else.
In New Jersey, we're 10 years after the lawsuit, and the difference between what it was like 10 years ago and the difference what it's like now is about this much. And that's based on $1 billion of investment. So you have to have the lawsuits to get people's attention, but to change those systems, it's really difficult.
Dr. Richard Barth is the Dean of the School of Social Work at the University of Maryland. He says, unlike Oklahoma, some states require all social workers to have a master's degree. Barth thinks more education means less turnover, but keeping seasoned employees is also related to the working environment.
When we actually look at how long social workers stay in their jobs, it's more related to the culture of the agency, whether they get good supervision, whether they feel like they're supported when things get very difficult, whether their opinions about how to change things are honored and considered seriously. That's what determines whether they stay in their jobs and whether they provide good service more than the pay itself.
Conference attendees heard about child abuse prevention programs that are working. Dr. David Olds pioneered the Nurse Family Partnership Program at the University of Denver. It's being modeled in cities across the nation.
We don't know how to prevent all child abuse and neglect, but we have good scientific evidence that we can make a difference with low-income mothers having their first babies by working with them during pregnancy and the first 2 years of the child's life with nurses who visit them in the home to help them really learn how to activate and support their what I think are really instinctual drives to protect their children.
Professor Asher Ben-arieh is director of the Haruv Institute in Israel. It develops and operates training programs in the prevention of abused and neglected children.
I think that there is enough knowledge in both places for each one to learn from the other and to share what we have with people and children who needs it in other regions of the world who didn't develop so much knowledge up to now.
The experts said all the data collected and policies to prevent child abuse and neglect must now be put into practice.
There's not a lot of connective tissue between what we've learned and what we do. We've learned a lot in 40 years, but getting it put into practice on a day-by-day basis by caseworkers and supervisors and judges, it turns out to be a challenge we have not met yet.
Attendees believe they forged coalitions to try and meet that challenge.